New psychoactive substances have certainly received a lot of media hype over the last few years. There's no denying that they certainly do exaggerate on some of the risks and harms. Certainly when we see stories about nitrous oxide, or hippie crack, as the media loves to refer to it. I don't know one young person or one professional that ever calls nitrous oxide hippie crack, but that's the terminology that the press uses. It's also clear that the national media does also report on the number of deaths from new psychoactive substances more often in comparison to illegal substances. So, for example, 1 in 4 deaths from new psychoactive substances is reported, compared to 1 in 90 when we're looking at substances such as heroin or methadone. So yeah, there is a huge amount of media coverage, and sometimes it is exaggerated, but we need to kind of also accept that actually these substances are a real threat to our young people. We've currently delivered a consultation and we've engaged with around 300 young people in Northamptonshire alone. 70% of them knew what new psychoactive substances were, and 24% of them had taken one.
Chloe, perhaps as a young person, you can sort of give us some of your views and what your thoughts are on this.
Personally, I haven't seen that much been mentioned in the media about legal highs, and I've spoken to some of my friends about whether they had seen legal highs being mentioned in the news, and they haven't. So it should be more. It should be mentioned more in social media, maybe the news on TV, because I think that all young people have heard of illegal highs and the risks to illegal highs, but less young people know about legal highs and the risks.
The short answer to the question that's posed is I don't know. And I challenge anyone here to actually definitively answer that. Why don't I know as a professional police officer? Well, we are pushing very hard, we have been doing over the last few years, around evidence-based policy. It's not doing what we think is the right thing to do, but doing what the evidence tells us. And we're very good at evidence because that's what we do as part of our investigative role, but I'm talking about the evidence that says this is a better tactic than that. And actually there's not a lot of evidence. Why? Because we don't collect it. Because it's illegal. So therefore, why would we?
If you guys imagine if you've ever been to Kettering General Hospital or Northampton General Hospital on a Friday or Saturday night, it's absolutely rammed with a number of different incidences. And the medics need to treat as many people in a timely fashion as possible. So recording isn't always the top issue. So often novel psychoactive substances, and indeed even Class A drugs, will simply go down as poisoning. But poisoning can also be a 2-year-old that swallows a dishwasher tablet. So it's very challenging. We don't have a huge amount of data. What we do know is this: since NPS has become a bigger issue, we used to have 2 emergency assessments on average a night in the county. At our peak now, we're doing about 30 to 35. When I first found out about NPS within Northamptonshire itself, it came from one of our nurses calling me up in a panic and saying, "Dave, I've seen 12 people today who are all psychotic, so throwing things, hearing voices, not behaving as themselves." So we have that evidence base, and then we have some colleagues further south from here in the police where they are trying to collect some evidence. And when I was talking to one of my colleagues about this evening's debate, they said that in one evening they had 4 deaths and they had 18 call-outs that required hospitalisation.
Now, I've been dealing with new psychoactive substances for a period of at least 10, 12 years, not just in a professional capacity as a member of the bar, but also in an academic capacity because I'm a visiting professor at Queen Mary's too. But maybe 12 years ago we didn't talk about new psychoactive substances, and we didn't talk about legal highs either. The phrase that was bandied about then were designer drugs, which meant drugs that were not controlled drugs. So I've been dealing with these new psychoactive substances, and by the way, we're dealing with an awful lot of misnomers. I don't know who coined the phrase legal highs. I suspect the media may have played a part perfectly, properly and innocently, because by legal is meant that we're dealing with substances that are not controlled. But I'm glad that reference has been made to a wider cohort than those who are simply young, which is the word that appears in one of the questions. We're dealing with a potential threat to a wide range of population ages. And I'll tell you why it's a threat. And there's more than one way, by the way, to deal with a threat other than by simply criminalising activities. It's a threat because even those who produce the drug, but particularly those who sell the drug.
Yeah, I think part of the challenge is just like we don't know what's in some of these substances, we don't always know what the impact will be. So if I give you guys an example, it was about 18 months ago we had a number of cases all at the same time that had to be assessed, and we ended up hospitalising a number of young people on the Saturday. There was one lad who came in who was hallucinating, was very violent towards the police and health colleagues as well. And what was quite worrisome is under the Mental Health Act, he was behaving in a way where we may have actually sectioned him. So brought him in and kept him in for treatment. Now, what had happened was his friend that came in with him had disclosed that they had been taking NPSs. And what was very worrisome is if you have somebody that's taken a controlled substance, although everyone's different, experience shows us how we can monitor it, how we can keep them safe. If we need to put in clinical interventions to stabilise them, we can do so. With this, we didn't know what we were up against, so our clinical staff had to just observe. It took him 2 weeks to return back to normal.
So our ability to respond appropriately is key to delivering better outcomes. And as I said earlier on, anecdotally, we are seeing an increase in bizarre behaviour, which isn't consistent with the individual's personal history, medical history. It's something that's aberrant, it's out of the norm, and our inference can only be that there's a big influence of so-called legal high.
Really echoing what's been said already is short term, yes, we do know some of the harm effects. We do know that there is a high degree of anxiety for some users. Now, we don't actually know whether that is actually the product itself or the anticipated reaction. And I'll explain that. For somebody who is going to smoke a synthetic cannabinoid, they are expecting the same response as they would about smoking a spliff, a joint, cannabis. They're not necessarily going to get that same reaction with a synthetic cannabinoid. Absolutely not. They're having a very, very, very different effect. For some people, that causes a high level of anxiety and it causes a panic. So it can be very difficult then to see what's the reaction, because that's how they weren't anticipating what was happening to them, or is actually the product itself. What we do know, and I work very closely with the prisons, and the prisons has been useful for, it's a captive audience, if you like. So things that happen in the prison environment are discussed and shared, and they've seen a massive increase in people collapsing, hallucinations, depression, anxiety, panic attack.
These synthetic cannabinoids are also proven to be highly addictive.
Absolutely.
And certainly with some of the young people that we've been speaking to, and obviously the proof is in the situation in the prison system as well, that I know the Global Drug Survey has just released their findings as well, and that's the biggest concern with regards to synthetic cannabis, that these products, substances, are highly addictive.
And I think the other point is, let's talk about medicinal usage as well. That there are cannabis derivative medications that are used for things like multiple sclerosis and muscular dystrophy, but they're not classified for other disabilities. And what we're seeing is with some of our young adults who are going to university that try and use cannabis for medicinal purposes, and indeed informally have been advised by their medics to do so, are turning to cannabinoids, because if they're caught with cannabis, they will get expelled from the university and the halls of residence they're in. If they use a legal high, unless the university has changed their policy, they can't actually get in trouble for that.
But basically, by maybe the 6th of April, all psychoactives will be banned, and the regime will be coercive to the extent there are both criminal law sanctions and civil law sanctions as well. I'll give you the definition of what psychoactive means in a moment, but let me just say that there are a number of exemptions. Alcohol is exempted, controlled drugs are exempted, tobacco and tobacco products are exempted, caffeine and caffeine products, that includes the energy drinks, they're exempted, and medicinal products are exempted as well. And they've used, Parliament, created a legal fiction. They don't just say they're exempt, they say that they are not psychoactives, which in my opinion is absurd, because we all know that alcohol is indeed psychoactive. Kevin is quite right, it is not going to be a criminal offence to possess a psychoactive substance. It is not going to be an offence to use a psychoactive substance. It's not going to be an offence for an occupier or a manager of premises to allow or to permit a person to possess or to use a psychoactive. But it is going to be an offence to import it, even if it is for personal use, or to produce it, even if it is for personal use, or to supply a psychoactive, which doesn't have to be for gain, or to possess it intending to supply a psychoactive, and again, it doesn't have to be. I've got no doubt that once the bill becomes law, most head shops will close down, for the simple reason that most retailers are in it for business, they're in it for money. They want to be, actually, believe it or not, on the right side of the law, not the wrong side of the law. They're already beginning to shift their trade into other areas other than drugs in many cases.
There has been a shift since last year of where young people are buying their new psychoactive substances. I mentioned earlier, before they were going to their head shops, they were buying the brightly coloured packaging with the branding on. Now, a huge percentage of the young people we've spoken to have either got it from a friend, which this legislation will impact on their supply, and also they have been buying them from traditional drug dealers, not in the branded packaging, but in clear packaging, where they have no understanding of what the chemical is, what it is, and potentially, obviously, that's opening them up to other substances as well. So that's already happening in this local area.
I mean, first and foremost, if the bill becomes an act, the act is an act of Parliament, and as Chief Constable, I respect the will of Parliament. Parliamentarians want legislation in place to deal with a social problem, and I will respect that. I think there is a sort of effect when new legislation comes in, whether it's smoking in cars or whether it's a new Antisocial Behaviour Act, or any new legislation I've seen come in. There's a big build-up to it, and then it gets passed into law, and there's a sort of morning after effect in that the world is still turning, nothing's really changed visibly or tangibly, and people are saying, what happens next? Now, traditionally Parliament will issue, through the Home Office, they'll issue guidance. We will look at that guidance and we'll try and turn that guidance into meaningful, cost-effective training to give officers and PCSOs and our staff the knowledge in order to apply their policing skills and wisdom with this new knowledge. Some cops will want to use this very readily. They may have been struggling with a problem for many months, and maybe it's antisocial behaviour problem. Maybe at the heart of that is a head shop, and they will welcome the opportunity to apply the legislation. I think right across the service, what this effectively does for us, it gives us, it will give us new options to solve problems.
Playing more and more of a role where their workforce has grown to tackle a lot of these issues without a stigma. So they're investing at the moment on things like text messaging technology so that people can actually speak anonymously, if necessary, about any concerns they have. And we're trying to train our workforce around things like resilience and emotional well-being. So we have a 5 to Thrive initiative, which is all the things we need to be comfortable. We have protective behaviours that schools, and particularly primary schools, through our Targeted Mental Health in Schools programme, should be able to access to learn about how we can learn to be comfortable in our own skin.
We do not sit on any budgets, Public Health England. We work very closely with all of the local authorities, the police crime commissioners, and NHS England. So our role really is to protect and support, because to be fair, I'm not going to tell you anything that you don't already know. There isn't any money, additional money, to deal with this specifically on its own. So you have got to look at what is already being resourced and tap into that. NPS is a public health issue, but it's also a police issue, it's also a community issue, it's also a school issue, a university issue. I could go on and on. So it is, what we absolutely advocate is, it's about partnership working, it's about information sharing, it's about looking at what prevention strategies you've already got in place.
There is an opportunity to shift some money around. What I'd say is there's a huge challenge in right across the public sector to move money that we've got in place to react to things, to respond to things, to move that money up so that it's used to prevent things happening in the first place. And I think that's where real success.
Now my view is, if 18 agencies, for example, have got £1,000 each to spend, you can do an awful lot more with one pot of 18,000 than 18 lots of one. So one of the things I would certainly like David to take back and encourage is to get the group together, see what funding is available, and have one campaign to raise awareness of this.
We have set up a comms group that has all of our, that we're aware of, all the kind of key youth engagement strands. So that's Young Health Watch, that includes things like our Young Leaders Group, who are elected members of the councils, our Out There program for lesbian, gay, bisexual, transgender questioning, our anti-stigma program, etc., etc., etc. And we've agreed that we need to meet at least quarterly to coordinate our activities. And similarly, we've set up a board with county council colleagues to do that in terms of the initiatives we have across the statutory agencies. Because again, when I first came into post, I witnessed exactly that we had, 12 people wanting, or 12 groups wanting to do mental health awareness, and we were already spending £80,000 a year on mental health awareness, and it clearly showed me that we had more we had to do to raise the awareness that group even existed.
Yeah, though it's lethal, then I think young people would probably